Okay, so just reflecting on my first clinical whatnot. I'm at the Bone and Joint Center in Dickinson, North Dakota, which is it's a branch off the main center in Bismarck, North Dakota. Yeah, so being out here has been really, really good. I had done one of my ICE experiences at the Bone and Joint Center in Bismarck, and so I kind of thought it would be a similar pay situation. And it is, it's both outpatient and whatnot, but the patient population is definitely different. I know Bismarck does a lot more younger individuals, some athletes, whatnot. Here, the majority of patients are like 50 to 70 years old. A lot of them have total hips, total knees, total joints in general. And so it's a lot of that sort of clientele. We have seen as young as 14, and I think our oldest was 96, 95, somewhere in there. And so it has been a good wide variety, but again, like 50 to 70 is the average population, and then a lot of total joints. We are also a lot slower paced out here. My CI, Rianne Sadowski, just graduated from UMary in 2019. And so she has just had 1 year of experience as a PT. And so that's been really cool. But she's the only physical therapist here. And so because of COVID slowing things down, and her being the only individual, patient count is pretty slow. So like 8-ish a day. And so I thought at the beginning that would be kind of difficult, being that it's a slower count, but it's been super nice. Because of the lower census, I've had more time to document or really get into how to document or be efficient with my question asking and all of the different aspects of that. I've also gotten to be a lot more hands-on than I think I would have gotten to be if it was so quick. I've been able to practice my skills with my CI and then be with the actual patients. And so I've been leading more or participating more in the overall visit. So I think the slower pace has been great. I wouldn't have it any other way, especially for my first clinical. So yeah, a lot of joint replacements. With that, one thing I've really liked, having a fairly similar set of patients in our caseload, is seeing the different stages that different patients are at. That makes it really makes the different stages of progression make a lot more sense. So someone that's 2 weeks out of a hip replacement versus someone that's a month and a half versus 2-3 months, whatever. It's been really nice to see the little progressions and how they really help advance towards the goals. And so it's made the short-term goals make sense, but it's really made the long-term goals make sense and see how the progression actually takes place. So I've really appreciated having similar patients at different states of the rehab. So yeah, that's been good. Being that our census is pretty low, on certain days I'm able to observe surgery, which is great. Bone and Joint is a POPS clinic, and so physician owned. And so it's really a consolidated location. They actually just started seeing physical therapy patients this year. The clinic itself the hospital was built in 2014. So everything's pretty stinking new. But on our actual floor, there is the physical therapist, or my CI, an orthopedic surgeon, his PA, his 2 nurses, a radiologist, and then the 2 front desk ladies. And so it's all on one floor. So we've got our little corner and then a whole hallway of patient exam rooms. But if we have questions, we can literally just walk like 50 feet down the hallway and go meet with the surgeon. So that's been awesome. So I've gotten to build a relationship with the surgeon and his PA. And so I've gotten to watch surgery on a couple of days. And so that's watching the total joint replacements or fracture relocations, that sort of stuff. And that has been very interesting to me. I actually kicked the idea around of being an orthopedic surgeon back in undergrad, high school time frame. And so I find it fascinating being able to look at the musculoskeletal system and the vasculature, skeletal, whatnot, everything. But I don't necessarily want to do it. I appreciate the hands-on portion and really getting to, dig in with your hands and be physical and, use that 5-pound hammer or whatnot to do the puzzle that's on the exam table. But what steered me into the realm of physical therapy is getting to see the patients progress and see them on, it's not necessarily the worst day. We're going to help them get better and better and better, and then send them out on their way being better or as good or better than they were. But I do still appreciate the orthopedic surgery. And so being able to have my first year of physical therapy school complete with the didactic information, understanding the foundation and how and where things are and work, is extra fun getting to go in and watch orthopedic surgery. I went on a rotation in undergrad for about 200 hours of surgical observation. And so having done that prior to physical therapy school and now go back has really hammered in how much I've learned. And so that's been a really nice confirmation bit, external confirmation, seeing hip replacements before and after orthopedic or before physical therapy school. Now I can see when they move different muscles and understand what they're cutting through and understand what that might mean for rehab or why they do so well. Or seeing the knee and seeing partial or total replacements, and it makes more sense now. So that's been super fun. I think the smallest surgery that I've seen but makes the most sense was a trigger finger release. I'd seen one of those prior to PT school and then watching it again. I remember being confused in the past why they didn't completely snip the tendon or cut it, across. But now I understand that the finger would not work if we did not have that tendon. But it just makes a lot of sense the way they do the vertical incision and whatnot. And so, that's been taking my personal background and having seen a lot of these surgeries or studied these surgeries and then getting to observe them now, speak in higher quality medical jargon, whatnot with the surgeons. So it's a higher level. I understand it now, or I understand what's going on in the room. And then everything that's taking place in the surgeries, getting to then apply them to the different stages of rehab. It's been really, really fun seeing the during and after bits of the surgery. So that's been great, getting to apply the, sit down, study, textbook, didactic knowledge to getting to apply it into the real world. And so, okay, there we go. And so then just building on my personal background. And so I've seen a lot of this stuff, and then obviously have done my first year of physical therapy school. So I had done about 200 hours of physical therapy observation. And so, sitting, watching the physical therapist do their thing, be in the same room as the patient, but not get to do anything with them. I've also been through 8 orthopedic joint surgeries, plus other things related to personal life injuries. And so I've been a part of physical therapy a lot as the patient. So I've seen a lot of physical therapy, participated as the patient in a lot of physical therapy, had both first and second semester physical therapy school ICE experiences, but this is my first time actually working with a patient. I've also been a gymnastics coach for 7 years or so, and then a strength and conditioning coach for 2. And so those are 2 coaching professional roles, whatnot, but it's been so great getting to combine my interest with the body and interest in progressing people with my experience in coaching and leading all into one. And so actually getting to do the hands-on bit, or actually getting to create goals or create treatment plans, whatnot, for the session plans. It's just really good getting to move forward with my professionalism goals, whatnot, as progressing towards my career. So that's been great. And so with my background of being a competitive gymnast coach, and so understanding what certain cues work for different ages, and then also being a strength and conditioning coach for 2 years, it's been really, really fun to get to apply my cues or different strengthening techniques or stretching techniques to a whole new patient demographic. I've only really worked with majority youth, also like college athlete, whatnot is kind of the upper end where I've worked a lot with. And so I'm, again, seeing 50 to 70 year olds. And so you're talking like 20s and down. And now I'm in the later generations. And so it's been really fun to see the differences, but also the similarities in cueing and strengthening exercises and progressions. My CI is actually, since she just graduated about a year ago, or she just became a practicing physical therapist about a year ago now, she's brand new into the physical therapy world in comparison to other CIs. And so she's got the mental aspect there, but she's still experiencing things for the first time or learning cues that work. So it's been really fun to be able to bounce ideas off of each other from our different backgrounds. I'm also in physical therapy right now for my ACL. And so I just have been living in the world of physical therapy, which is amazing. So I'm, doing being on the therapist side of things, and then I quick jet back to Bismarck in the evenings and do physical therapy as the patient. And so for that, I'm at Sanford Power in Bismarck, which is of course an outpatient location. And so my physical therapist there, Brandon Dirk, is an absolute teacher. I know he works with us students at UMary often enough. And so it's been really fun to bounce ideas off of my CI, with myself, with my physical therapist, who's also happy to teach. And so a really fun example of that is that for my in-service, I had talked to my CI to see what was a good idea, and we talked to the orthopedic surgeon we work with, and we determined that it would be good for me to come up with different exercises for just generic shoulder pain. Patients will go into the orthopedic surgeon talking about the pain they're going through and not come across as needing surgery or maybe not even physical therapy, but if they could have some certain exercises, they could hopefully get back to a pretty healthy state. So we had come up with this idea with my CI and the surgeon, and then I went to physical therapy the day later and talked about it with my physical therapist. And he's crazy passionate on this stuff. I guess he's done lectures on it, and I don't know if he said TED Talks or whatever it may be. He's definitely, he's spoken at NASCM before on shoulder impingement and injuries. So he's been giving me ideas, and it's kind of fun because Bone and Joint and Sanford are kind of the two big outpatient orthopedic athletic-y places in Bismarck. So it's kind of fun to get information from one and pass it on to the other. And it really does speak a lot to the physical therapist as professionals, not just in terms of marketing strategy. So it's really nice to see physical therapists supporting physical therapists no matter where they're working or the patients they are stealing from each other. But yeah, so it's been really fun to get the different insights, apply my own knowledge, whether that's my injury or my injuries, past professional experience, past educational experience. Yeah, it's been really great to channel those in and combine everything together. Last little point I'll talk on. So in my future career, I think as of now that I would like to work with outpatient population, probably in athletic situations, so getting athletes back to their sports. But so what's been really fascinating with this outpatient setting, being that they are all in their, or majorities in their 50s to 70s, is I've opened my eyes more to who can be considered an athlete. In the past, it's been, middle school, high school, college. You're in sports. Professionals, you're in sports. But you can remain very athletic and in sport type activities for a lot of years. And so getting to work with, a 60-year-old that's a fireman and he's moving towards a knee replacement. Definitely an athletic population. Might not be in sports, but definitely, the career requirements he has definitely opens up different requirements for his rehab. And so it's opening my ideas or opening my spectrum for where I want to work in the future. So I'm super appreciating the diversity with patient population. It's also opened my eyes to how goals can stay the same or completely change as you get older. With personal injury and therapy, whatnot, being 9 and breaking a bone, and my goal is just to go play with my friends or do my sports or whatever, to being an adult and just wanting to make sure I'm functional in my career and can have kids one day, to comparing it with the patients I'm seeing here and they want to be able to play with their grandkids or they want to be able to live a comfortable life. It's been nice to see some of the similarities through the different generations or ages, and then also to see how goals completely change as you get into different steps in your life. That's been a nice eye-opening bit to working with these patients. I guess overall, I'm just really thankful for my past experiences, my schooling experience right now, and then the fact that physical therapy is absolutely confirmed what I want to do with my life. I'm having a blast getting to apply my didactic information and really, almost treat it like a puzzle during evaluations and picturing what's going on and seeing what could be the issues and how to go about it and fix it. But yeah, I'm having a blast. I am so excited to keep on learning, whether that's didactic and foundational, learning some of the therapeutic responses to injuries, whatnot. I am extremely thankful. So we've got about 3 more weeks left, and I cannot wait.